want to try to do today is really 2 or 3 big things. First of all, pat us on the back, the Impact Evaluation Committee, with the caveat. And I'll be going, and this is the supply side and the demand side. We're going to be looking at how policymakers have started to use this from a fairly large-scale survey, and we look at that. And it's mostly good news. Now, I think actually what Bill just said here was that the research process, probably the funders and the donors, I think have actually driven this. And it's us researchers have responded to incentives, right? And I think that's very important. And I haven't heard that discussion because we know how the donor community moves through different fads and moves through different trends. And I think that's probably one of our biggest points is that it's worked with the caveat mainly because we, the research community, has sort of been forced into it. Now, some people have gone willingly, others not so willingly, but I think that we need to think through of those incentives. Second, I'm going to do something really hard. And that's really trying to say how we do a better job at taking evidence-based impact evaluation and turning it into policy. I'm going to share a little about my group and how we've done it in China and how we've evolved. And then I'm going to really try to couch it then in trying to draw out the lessons for other countries. China's a very, very different place than other places, but I think that there's some basic lessons perhaps that we can learn. Okay, so motivating questions more than a decade after when will they learn? More than a decade of increased focus on evaluation with the emergence of JPAL and IPAs, the SEGAs, the multilaterals, the evaluation departments of many, many government and aid agencies. We're wondering, right, is the development community learning what it was hoped from impact evaluation? That's sort of the whole topic or one of the topics today. But again, and the second question is it really changing the way we're doing things? So I'm going to focus on the first part, sort of recent and current status of the impact evaluation field, and do a very quick review. It's drawing very heavily on 3IE's repository and other search engines that our team went through. Then I want to look at the future of impact evaluation on development interventions. So our goal is to sum up the successes, right? The patting on the back with caveats, but not only from the supply side. I think of it like this too, as supply side. We really tried to get into demand side. And I wanted to listen to how policymakers were telling us that they interacted. It's actually quite interesting. I think we're all seeing the same thing. We use different words. It depends how you view economists. You either see a little bit of arrogance in us of how we approach it, or you can sort of see that we're being pushed into this way and we're responding to incentives. And you can see a little bit of arrogance, the same thing on the policymaker side. Yeah, this evidence is okay, but it's really my own initiative that did this. And I'll show you some data from our, and then we'll try to provide a little more guidance for effective evaluation and research-driven policymaking. Okay, so 2 parts is the current state of impact evaluation focused on the field in general from both the supply and demand side, and then the future, perhaps, probably that's too grand of a topic, focused more on our experience in China. So I'm going to review to do this first part, I'm going to do 2 things, part A, subpart B. The first question where we review the literature is the development community learning what it hoped to from impact evaluation? Are there gaps? What's the quality? We actually tried to get into the quality of them, and then we'll talk about more of the demand side from it there. So, and for illustrating this, we focused on 3 sets of fields, and that's health, education, and social policy. I'm not sure if you looked in agriculture, if you'd find the same thing. If you looked in sanitation, perhaps. I think this is probably pretty general. Our approach was we use a 3A database. We use search engines for PubMed and for 2 or 3 other search engines, looking for journals, books, reports, working papers that use rigorous methods, randomized trials, regression discontinuities, propensity score matching, IV and D&D. Studies had to be published in English. We actually did the Chinese side in Chinese also, and the evaluation had to take place in the developing country, and there were several thousand studies that made it over this hump. And there's the cumulative distribution graph, right? For health oriented. I mean, several hundred for the whole decade from 85 to 90. From 95 to 2005. There was a handful per year, right? And you can see the explosion that happened. And in health, they're almost all RCTs. So, yeah, I mean, this is the public health field. The medical people were very, it's not very changed. Some D&D, you can see all the other types are sort of lumped down there below the quasi-experimental ones. From 300 to 1200, and this is the summary over those time graphs. Now, when we start looking underneath there, and I'm going to be addressing some of the issues over some of the criticisms I hear, right? Doing single intervention educational input studies. That's all you guys do, right? And I think you're going to see that we do a broad number of things, but there's some things we do a lot more than others. Nutrition, child nutrition, a huge rise in the number of studies. There's been almost thousands of studies, hundreds and hundreds, every year on these 2 topics. Health services, preventive health services are also have been, just out there, and we've had thousands of studies come out on this. And I know some of the meta-analysis that 3IE and others have started to summarize this. And so we've done less well with broad sector reforms, right? Health financing, hospital management. There's been rises, but still two studies a year, 3 studies a year on these across all developing countries. We don't know much about that. The same thing. And so we do a lot on intestinal worms and anemia and vision problems. And we always get, you can't solve these things one at a time. And that's all you guys do. With exception for HIV/AIDS, which there's been, a big effort into, these studies of specific diseases, the malarias, the TBs, there hasn't been that many that are just that narrowly focused. And I think I learned that. I was thinking we'd find something very different. Now we had to combine them all together to put together meaningful numbers. Education is sort of the same story, but at a much lower level. There has been the same boom in education. About half of them are RCTs. You can see, our RCTs are a big part, but difference in difference, RD&D is a significant share of these new studies that have risen. Lots and lots of different subsectors. We've done most of the work, and it's probably the right thing to do in developing countries, has been on pre-primary and primary education, not an insignificant on secondary education. So a lot of it has been done there. There's educational inputs, right? Is putting the one teacher assistants in there, putting a computer in the classroom. I always, shouldn't you get the teachers and the classrooms and the curriculum right, and then you don't need all this other stuff? There's been a big rise in these studies, but that's not where the focus of the field has been. So I think I learned that also. Much less big gaps on girls' education and scholarships and system reform. There's almost nothing done, on these, even, after these 10 years. Social policy, I'm much more, you're going to see we're going to do this sort of for China. we've done one social policy evaluation, and that's 10% of all the ones done in China over the last 50 years. There's only been 10 done. So I'm actually not immersed in this, but there's been a big rise, actually more than education, working on them. And they've been in conditional cash transfers, microfinance, employment, and labor markets has been these three areas have been the massive rise, while a lot less, again, on these systems of insurance systems and safety nets and pensions, that there's less, work done on those. This is some done on insurance. That's the insurance we had hugely broad. We weren't sure if we should put agriculture insurance in there, crop insurance, unemployment insurance, and so that's sort of a hodgepodge of categories. So the record's good, but we do see gaps in this record. Many, I think, in health and education, most are randomized control trials, for better or for worse. Just as a caveat, we find randomized control trials when we work with Policymaker, sort of foreshadowing what I'm going to talk about, are really effective. I mean, they like them and they get it. Even if you try to dumb down quasi-experimental things. But so I think that we could do better. 3IE is the cause, Howard White and causal chain. I think that's his middle name, right? And when you try to apply for a 3IE grant, it's over and over and over again. We've actually systematized it in our group, and we find it very, very useful. We were dragged and beaten there. A lot of papers have it. Some take it seriously. A lot don't. So there's lots to be done there. Cost-effective analysis is often, it's just not there. Even simple cost-effective analysis, we're mea culpa. We haven't been doing it. We're actually taking the summer, a whole month of a retreat. Everybody's bringing all their data sets, all the data that we've identified. We're going to do cost-effective analysis for as many of our interventions that we've done, because we think it's really, really important. And so this is an area that there's lots and lots of work to be done on. So, patting ourselves on the back with a caveat, and there's still improvements with quality. The quality certainly has gone up. I should say that because of the rise of causal chain analysis, I think you see a lot more zero impact studies. So there were almost none published before 2005. You just didn't see them. Sometimes in the public health literature, but certainly not in economics. They're still rare, and I've seen the other papers done looking at the pre-analysis plans and the registries, and then the final publications. You see a big gap. So people still aren't publishing those that they find zero impacts on, So there's big change. Okay, so is this work getting itself into policy? And so what we did is we did key informant interviews and key informant surveys. We actually did systematic surveys of evaluators, think of researchers in the impact evaluation field and outside the impact evaluation field. We picked development economists who, have been known to be criticizing this. So we had a selection of those. We actually made a great big list and randomly selected off of that. And then we have implementers, 8 agencies, international organizations, and policymakers. We sent out surveys to 40 of the top impact evaluation scholars. They were from these evaluation centers, individual scholars from universities and development banks and organizations. We did a pilot with 25 questions, and we got back 1 out of 10. So we reduced it to 8. And almost everybody responded, not only with, yes and no's. We had lots and lots of qualitative comments. So I'm going to share both of these with you. And so does impact evaluation generate bodies of evidence that address questions at policy? Remember, this is the researcher point of view, right? And I'm show you almost the same question from the implementer. And most of them say yes, right? And there's still 25% say no. And every question, by the way, we ask, is it more true now than it was 10 years ago? All right, and that'll be down in the corner here in the bottom. And you can see that researchers are fairly optimistic that, first of all, they're doing policy relevant work, and it's more and more than 10 years ago. But I think we learn more from these comments. What we ended up doing is we summarized some of the most salient comments and sent them back to everyone and said, do you agree or not agree with this? Because I didn't want to put anything up there that everybody said, that's, Mr. Smith, and he's, nobody knew who it was, but, and so these are ones that came back and they said, I wouldn't object. So we just asked them, would you think that this is representative of a lot of our thinking in the field, and not necessarily yourself? And so that's the only ones I'm putting up here. So they say, the literature's often, though not always, generated bodies of literature that policymakers and donors need. Sometimes our research is producing more fundamental knowledge, so like basic research. And then this says, in many cases, the policymaker may not even realize they need the evidence. This is sort of this is what we're known for, right? But we're producing the information they need. I mean, believe that's a very common, perception, and it's going to get at some of the tensions that are out there, and it's spread through this impact evaluation with policy relevance literature. Before I start a new impact evaluation, I consult with policymakers or implementers about the question. I mean, look at this. I mean, nobody says never. I mean, everybody says always or sometimes. Even the non-impact evaluation people that do that. I definitely check what policymakers and implementers think, do, know, but I sometimes decide the questions that they are not interested in are important. Isn't that great? I know. To do most impact evaluation requires this is, I think, what's really important. And these questions these comments, I have to do it. Okay? I'm getting my money from them, or my money is tied to working with them, and they make me do it, so I do it. And I think there's some lessons there. So after I finish an impact evaluation project or paper, I disseminate those findings directly to policymakers. Half, always, half, sometimes. Everyone said more than before. I mean, I thought there was not one person that said before. And here's some more tension, right? This is hard. As an academic, I get little personal benefit from pushing. I want to publish in the top academic journals. Spending time flying over and giving workshops and writing blogs doesn't pay off in my career. So any effort I put this into it is due to the fact I personally value this, or because I'm made to do it, right? I do this more often now than 10 years ago because a greater share of my evaluations are done at the request of donors and policymakers. I'm made to do it. If you do this, if you give it to the policy, they're made to do a lot. We're made to do workshops and policy briefs and direct communications and even some media. I mean, there's a lot. I mean, I was actually surprised at this, that everyone, that when conditional on doing that. And then finally, policymakers engage in dialogue about or seek to use results from an impact evaluation or papers. And it's basically the same story. One of the benefits of doing the work for their policy relevant, it helps with funding. I needed to get access to field resources, right? Exactly. But I think there's really lessons there. Now, 5 researchers, 2 called me and 3 wrote these really long. It was I was moving, impassioned. I think I do this better than anybody because I believe in it. I went into development economics. So there is intrinsic value in there. I don't want to say that there's not any of this there. And then what are the major barriers to do? Working with implementers is time consuming. You have to distort your research agenda and it's harder to publish. That you see 60% of the people. And finally, what are the and so, that's, yes. So we asked this question. Very funny. This is absolutely not true. So journal editors can make a difference from here. So there is a tension of policy dialogue. There's tension between high-quality academics and policy relevance. A lot of impact evaluation is focused on policy is driven by funders and government departments. And according to evaluators, there's a lot more going on than a decade ago. So what do the implementers think, right? We went to 75 implementers from the development banking community, bilateral funding, actual policymakers. 8 survey questions about this. They were sort of the mirror image questions, and we let them tell us over time. And this is what they said. So this, not only economists are arrogant, I did it myself. Is the number one reason. What was the primary mechanism behind a recent policy change? Political pressure, outside funders, and 15%. Now it's the primary. We stressed in this one, this was the reason I changed policy. Now, if you said, did evidence play any role in that? 62% said yes, 39 still said no, but and everyone said much more than, and remember, this is all policy here. This was a single policy. So everyone basically was saying that evidence is out there now, and it does play a bigger role than before. So what extent did that play a role, and where did it come from? This is very interesting. It was almost impossible to put a graph together because there were almost 70 different answers here. About 15% of implementers said that evidence came from the researcher or researcher institutions per se. So this long-term partnership, that's not what's driving most of this. And you're going to see that's where we've actually found our biggest policy traction, but most people don't say that. A common answer about 40% of the time was something that said that evidence was generated as part of a project. It was either commissioned by their own institute or by the donor, and it was part of the project, so that's how they dealt with it. Does impact evidence generate bodies of evidence that address questions that you as a policymaker donor have? Most of them said yes. Most of them said, that it was happening before. Most of them said it's happening more now. Now, the next 4 slides I'm going to go over quick are all about the dialogue. And you can see the graph's going to look like the same, more or less, where some say always, most say sometimes, a few say never. But it's about, I have been consulted about questions that interest me. Always, sometimes I've received findings directly from the impact of, remember, the evaluator said, I always give direct communication. They say sometimes, okay? But maybe it doesn't get in everybody's hands. Have they engaged me in dialogue afterwards? A little less, but still most is always or sometimes, and most more than 10 years ago. And I've actually acted on results. So this dialogue is there. I mean, the dialogue and where it's being coming from, very few nevers. I mean, I think that I was expecting, a few more there. So the rise of this is the overall for the whole first part of IEs conducted over the past decade has at least been partially matched by an increase in the generation of bodies of evidence that are relevant and accessible to policymakers. It's out there, no matter why we did it or it's there. Nearly all implementers agreed that there were these dialogues going on. It's not perfect, it's not full, but certainly every single person you saw, better than 10 years ago, better than 10 years ago. So this has really changed. Our interviews also suggest more work is needed. Evaluators report that incentives are against this work. I mean, there's tensions out there. We have tensions in our own group. One of our keys to our success is we replicate over and over again, different settings, different processes as we try to refine a model that then gets upscaled. If you're the assistant professor that gets the 7th replication, right? It's, the big journals don't want that, right? And you have to end up going to, the Asia Journal of Education Policy, which, as a 60-year-old professor with tenure, I'm happy that I get my Chinese colleagues on there and we publish it. But that assistant professor that wants to get tenure, in Georgetown or BU, those guys, that's not going to cut it, right? It doesn't even count on their resume. And so there's tension. Dissemination is more by rote, right? We're forced into it. But I think that funders have played an important role of this, and I think that they need to keep the course if we think this is important. Maybe dig the screws deeper. Don't, but maybe, right? To keep us on track. Impact evaluations appear to be high quality, but more work is needed. Therefore, further work. I think we need to really sit back and try to digest this and the work of others, and try to figure out sort of where we're at. Now the question is is it changing policy, right? Are we actually, and you saw it's engaged in the policy guidelines, and how are we doing that? So what I'm going to do is just sort of quickly try to look at the case study of my group in China, but really try to search for lessons for the rest of the world, may or may not be applicable, and try to talk about the costs and benefits of doing it. So before we look at the future, let's look at the situation is in China. So this is our impact evaluation review. We started REAP in 2006. We examined the Poverty Action website for studies done in China. There was one. I mean, there's like 150 in 2007, 150 studies on JPAL's website. There was one study on China. Today, there's 606 studies on JPAL's website. 9 are on China. China has not got the focus of at least the MIT Harvard impact evaluation group. If you look at the 3IE repository, South Asia, Sub-Saharan Africa, Latin America all have a lot more impact evaluation than China does. And you can see that 1995 to 2004, this sort of same period we used to look at the whole world, there were, yes, 13 in that whole decade, 13 impact evaluations in health, education, social policy combined. I mean, this is, by the end of this period, China was the second largest economy in the world. They had one impact evaluation per year. So in health, they had one every 3 years. In education, they had one every 3 years. In social policy, they had one every 3 years. And they're spending trillions of dollars on this, okay? So certainly, when will we ever learn was pointed at countries like China. They've learned a lot more, but not very much. But so the increase, 136 published impact evaluations on China between 2005 and 2014, 10 per year, right? It's, again, lower than almost any other region of the world. And about half of them are RCTs. The number in China is still very, very small. So this is just sort of to show you where our group started in 2006, fully has done a quarter of them. So one set of research team, I'm very, 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 very proud of this, that we've done this. I mean, we've only done 3 papers a year or 4 papers a year. I mean, so we're proud of it, but it's not like it's, if we did a quarter of everyone in the world, but no, I mean, the next second largest group is 3. There are no impact evaluation groups in China. That's one of our points that we were studying, and when Kristen wanted us to do this, we were very interested in this. And of course, we're Rural Education Action Project. We've done 3/4 of the education. There are much more public health studies, and I told you 1 out of 11 social policy studies. Very, very few. So okay, so if more impact evaluations, same with the rest of the world. Have these helped a role in policy change? So our group, again, we were commissioned this paper, and we were told, focus on your group. So it's I'm just reporting. It's fun to talk about your group. I mean, we actually learned a lot. We have had many policy successes. Now, before I tell you what these are, there's lots of caveats. It's in a big soup. I love that word. It's in a big soup of evidence and political networking and relationships. There's one group out there that does zero impact analysis evaluation. That's probably the most influential group. They go out and they do one pilot, and then go up and tell the premier, who's their high school buddy, and things change. I mean, for lots of times for better, sometimes not so, but so, and they're involved in these. And not all of our efforts have succeeded. We have succeeded. We're very much behind a national nutritious lunch program. 26 million kids, $2 billion a year of school lunches, nutritious school lunches. Evidence-based research played a big role in that. Financial aid for high schools. Every poor kid in China who wants to go to college can get a scholarship, no problem. High school is almost as expensive as college, and there's no financial aid until several years ago. China didn't realize that they have the highest tuition of any rural public school in the world, by far, 10 times higher than the second country. No one knew that, and no one knew that it was keeping kids from going to high school. They now have a financial aid program for high school, expansion of preschools, reinvesting in deworming. We're now in progress of doing parenting and nutrition program. This is an effort done very closely with the government, actually with the new 3IE member, where we're trying to take, I always call it the world's largest bureaucracy, the Family Planning Commission, right? This is the group that did abortion and sterilization and cut fertility from 5 to 2 in 10 years, right? Had terror stories. Nobody wants to have more than 2 kids now. They want to transform themselves into a million-person bureaucracy that fosters quality through nutrition and parenting. It's very, very exciting. Strengthen rural teaching through incentivizing teachers. These are jointly with they're all around, the government members are all around this table over here. We have other issues too. So we've done failures. I wanted to put some failures up there. We've done 4 or 5 conditional cash transfers to reduce dropout from middle school. Wages are rising. Anybody can get a job in China. There's 1.5 jobs for every person out there now. Turnover for factories is the biggest problem in the world. So kids leave school early. They go get a fake ID and are working in a day. We've showed that if you pay families to keep their kids in school, it works. It reduces dropout by 60%. I don't know how many times we've had that, our government colleagues nod at local level and central level, and they say, "You don't understand China. We can't do that. We can give free education, we can give good schools, but we aren't going to pay families to send their kids to school when it's to their benefit. Of course, there's a social benefit. We try to teach them, but it's been total failure. I've taken groups. I've taken groups to Brazil. And everybody gets excited, and then you go back and say, "This doesn't fit China." It's sort of total failure of us. Boarding school dorm room managers for preschools, life counseling to really try to get students to be able to communicate with parents and teachers. Great success. One province put a dorm room manager and put a life counselor in every classroom. By the next year, they had teaching assignments and weren't doing that anymore. And so the upscaling was total failure. There's lots of failures too. So let me do the last thing I want to, and this will take about 5 to 10 minutes. This is how long I've been?
That's how long you've been.
Okay, good. So about 10 minutes and I'll give you a little idea of what we are. What I think are key elements of success, and mainly this lessons for others. We really are we're an impact evaluation organization. IPA, SEGA, JPAL, that's sort of where we started, patterning ourselves. But we aim to sound education, health, and nutrition policy. We want to be very narrow, and we work only on China, and our ultimate goal is to change policy. So this is where my assistant professors in our group, our collaborators, sometimes we get into these, I want to do this, and we then say, is it policy relevant? There's a big migration call for proposals out in DFID now. And I've got 2 assistant professors. I want to write proposals on changing migrant schools. Well, it's like these are informal migrant, and they've never worked. The government's not interested in them. So we're having this big tension over we should even do that. Okay, so those are so we're focused on trying to change policy. We do 2 things like all the groups, exactly what you said. We design and implement new programs. We do it with NGOs or foundations, or we copy the Segas and the JPALs of the world. We find out what they're doing and try to introduce them. Have government agencies, officials observe, and if successful, we try to interest them in going further. So very much sort of exploratory stuff. But what we also try to do is partner with those government agencies to implement their own projects, program, and investment, where we help them design the rollout, they carry out the implementation, and then we evaluate. So, I mean, sort of what most of our impact evaluation groups. So our core group are Shanxi Normal University, Henan, Sichuan University is our public health group, Chinese Academy of Science in Beijing, and Stanford, and we have many partners in other universities. And I think what's most, what we're sort of proudest and we've worked hardest to do is set up a network. In every province, we have a partner, an academic partner. And you're going to see why. I mean, that they're all over here. I'm going to tell you a little why later. It's about making connections to the local officials. Those local officials are their students, and there's trust there, and some other reasons. But we also have many government partners at the national level in these key measures, but at the provincial level and at the local level. So this is Shanxi. There's 10 prefectures, groups of counties. We have ongoing what we call PACs, policy action consulting teams. It's not to give money to the U.S. government. These are to give money to them to do projects in prefectures, in counties. In fact, we have 42 prefectural governments who are our partners, and we have 300 county government. Our partner in Shanxi Normal University, his whole job is to keep track of these guys and to work with them and to continue to interact with them. And we work in pre and primary school, secondary school. You're in the Silicon Valley. Everybody wants to give us computers and do long distance learning. So we have a program in there, and we have one in teaching, just because I think it's so very important. And there we've had more than 50 quasi experiments and RCTs over the last year. So what are our key elements? How have we made these do that? I think that there's 3 things for success: partnerships, division of labor in those partnerships, and rigorous and complete methodology. Yeah, and this is every group. Every good group has rigorous and complete methodology. I'm not going to spend a lot of time on this. We have one sub-theme that we do a lot of. But I think our partnerships this is the key, and this is where I see other groups. I mean, I work with my colleagues who work in India. They're forever getting on planes and racing to the field to solve big implementation problems or funding problems. We work with partnerships that are long-term, collaborative, experienced and committed, mutually beneficial partnership. And I think it's the mutually beneficial partnerships that sort of make them sort of stick. And a lot of it is, I've been working in China for 30 years. Our assistant professor has been working in China for 15 years. We have postdocs that they were working in China for 10 years before they were postdocs. And we have a staff that all know everything we do is in English and in Mandarin. And the partnerships have lasted. I've worked with the Chinese Academy of Science for 28 years. Stanford and Shanxi Normal University, we've worked for 16 years. The Chinese Academy of Science, our Chinese partners have worked together for years. They've worked with our local partners for more than a decade. Our new partners, we just want to work over and over. You have to have these long, repeated interactions. And how it's glued together is we share more than that. You go look at we just did this. The average number of co-authors, on JPAL is 2. The average number of co-authors on ours is 8. Oh, there's economic journals that say you can't have more than 10. Then we have this terrible, who gets cut, right? And it's usually me. It doesn't matter to me. But or some of our other senior scholars, because we bring visiting scholars together. We teach capacity building of these courses. We invest in them. We co-mentor students. They mentor my students. I mentor their students. This is absolutely, it allows us to work without contracts. We give millions of dollars a year to these guys, and we don't have a contract between us. Little mutual monitoring, high division of labor that I'm going to go into in a second, and we expect. What's the lesson of theirs? I think that it's worth building partnerships. Now, the partnerships have to have division of labor. This division of labor is needed because policy impact, there's a lot of moving parts. If you really want to move policy, and that's what we try to do more than at the end of the project, go have a workshop, write a policy brief, go have a cup of coffee with the policy director, and then write a media story on it. We want this long-term engagement, and it's very, very hard to do, especially when you're in a big country. But I think most countries are like this, where there's a central government and local government. And China is very highly centralized. Funding comes from above. Political cover, the stamp that it's okay to incentivize teachers. It's okay to change national training standards. It's okay to do innovative curriculum in vocational ed schools. You need the national government to say okay, but the implementation is all done by local governments. The national government knows nothing about what's going on in schools. Principals and school district superintendents have enormous power. And typically if there is monitoring, it's not very positive. The division of labor. Chinese Academy of Science has direct access to the top levels of government. This is not relevant to other countries, though I know in smaller countries that often our policy teams do have very good relationships with the government. So I think how it's done, this system of direct access of scholars is actually from the Qing dynasty when the emperor was sick and tired of the ministers keeping all the salient information from them, so they took reports directly from scholars. And that system goes on to today. We write 4-page evidence-based policy briefs. It goes directly to the top leaders of China. They then give us feedback. They give you feedback within 2 or 3 weeks. Say, this is approved for policy action. That means nothing, oftentimes, except here's political cover to go do something. We bless for that. Sometimes they write a check for $100 million, just depending on the issue. So this doesn't necessarily end up changing policy. This has happened 23 times in the last 8 years, and you can actually go see these on our website that we've put them up there. So, but the blessing at the top is only one step. Where did the evidence-based research get carried out? You don't do evidence-based research on rural education in Beijing, right? Who's able to use the political cover and take the next step of the newly endorsed programs and projects? Certainly not government officials, it's local leaders. And so that's where we need our second partner, is to work with the local government in these participatory policy action consultation teams. There where we design evaluations, we implement, we upscale. And depending on what stage of the project, these things do very different. In these new projects that we bring in from outside, they're observers, and it's very important. They don't want to fail, right? And so we put them over here, and if we fail, we write a zero impact paper and try to think why not. If it succeeds, we try to let them take credit for it, and then hopefully then repeat and find a way to upscale, and they can get themselves promoted or at least their locality noticed. So the partner, our local partner, remember all these guys here? they work with these locals. In China, local province leaders are almost always educated in local universities. Local leaders are highly educated. All of them went to college. They're often students of these. There's trust. Here, I mean, look at the informal discussions that go on. I mean, they just, there's a research team, and there's the director of the Department of Education of a province of 60 million people, just sleeves rolled up, working on things. There's more formal meetings, et cetera, et cetera. They also, very, very important for us, is our local collaborators access a large number of students. Smart, motivated students. I mean, these are the guys who implement and do our evaluations, right? Huge numbers. The great thing about China is once you get into university, everyone graduates. So you don't need to go to class. So you can come out to the field. We're totally against tertiary education change. No, that's not true. That would really crimp our style. But we actually believe we're giving these students fantastic, a supplemental education to go, and they're key to. And then we bring the ideas, the funding, the project management, the capacity building, and again we share data, publicate, and it's these partnerships and division of labor that can go on. And finally, I'm not going to. We know what rigorous methodology is. It's committed to impact evaluation. Quantitative experimental design is essential, of course. Like I said, we find leaders love RCTs. They just get it. I mean, of course, you can't do everything in an RCT. I mean, we know about a third of ours are quasi-experimental. And policymakers want to know more than if a pilot project were. This is what, if there's anything that tells us that we were forced and kicked and pushed into doing causal chain analysis, it's when we finally really started to engage our PACs members, is they almost didn't even care if it worked or not. They wanted to know who, in general, they want to know who it was working for and how to make it work better. And that's really what they want to know. And of course, what they're thinking about is upscaling. So there's 4 parts to every protocol. We have a protocol that we put together, and that includes cost effectiveness. This is a new. I can give Hewlett credit for pushing us into this, and in the process of writing this paper, we discovered this, and it's now going to be part of our protocol. I'm going to probably quit right there. Earlier in the week, we had a little session with the members where we talked about finding external validity and assessing and searching for upscalable models. One thing that we believe in is replication inside China, looking for external validity. What setting? The Chinese government is putting, I think it's like $10 billion worth of computers into rural classrooms. Do they work? I often say, let me just show you one. This is what most of them are used for, right? They put these, they're used for this, right? They're putting $10 billion and they're useless in the classroom. It's because teachers don't know how to use the machines and there's no educational software. We went to the literature, and they said there's these fantastic remedial tutoring programs that have been run in India, and then they've been run in the U.S., they've been run in Mexico and Colombia, and they worked. And so the proposed solution is, let's put a package together. But, classrooms integrated in here. But classrooms in Han rural China, in migrants communities, in minority communities are really, really different. And they're going to put computers in all these, so you need to replicate. And then once you replicate, you find out it works in some schools, and then you need to refine the process in phase 2. That's the Qinghai. These experiments in phase 2, we do find big impacts. But it's not done there. These guys now want to upscale, but we aren't going to do the upscaling. The government's going to do the upscaling. And so we have an upscaling program where we work with governments, and in this particular computer-assisted learning, we went to every single school in the province that had a computer room, and then randomized it into 3 groups: a control group, which is now the year 3 is getting actually computer-assisted learning. One group which is we implemented, and then one group where we pretended like we were a work team from Beijing that came and taught the prefecture how to do it, and then said, "You guys go implement this project." So it's like the government versus REAP in upscaling, and because we know that we're going to succeed. We've done this 7 times, okay, and this is us doing it. This is us training them, and we then do the experiment, and look what we found. The government upscale had no impact whatsoever. I mean, yay! We were very, our government, of course, the causal analysis said why, and at the end we found that actually this was an English teaching program. If a non-English teacher did it because you made the English teacher teach his own class instead of shirking and just letting the computer do it, put it during a computer class, don't substitute. If Cal is supplemental and doesn't replace other classes, actually the government program works equally as well. And so, wow, you should see the new rules they're rolling it out across the province now is English teachers shall not be Cal supervisors. English class shall not be replaced by Cal. And they learned it, and now they're upscaling. So main points for the whole thing. Here we go. REAP can't be transplanted to other places of the world. Context matters, right? Huge country, high levels of decentralization. Local leaders get promoted based on innovative solutions. There's an incentive to innovate, although there's an incentive not to fail. Also, local collaborators are highly educated, are implementers generally, and get promoted based on our local partners, are highly educated. They all have PhDs. They get promoted based on publications and academic output. You need to have SSCI and SCI publications in China to get promoted to full professor. They have an incentive to publish in the English language literature, and it's very, very hard to do. Beijing CAS collaborators have direct access to top leadership, and local partners that's our local collaborators partners, have relationships with local leaders and have access to a large number of smart, motivated students that don't need to go to class. Take away any one of these, and sort of our program, it doesn't work. And so obviously no country is going to have those same things, but I think there are lessons. Investmentship and partnerships, key. Can donor agencies do this? I don't know. We were just talking about Ford Foundation's commitment to us over the long run. I think that they're a big part of responsible for keeping those partnerships going, especially through lean times after Tiananmen, after the Asia financial crisis, et cetera. Use of after other multilateral donors and bilateral donors left. Use of PACs. Engage local leaders. I don't see very much of that happening. I'm working with the Ministry of Education in India. Great. But are you working with this local Bureau of Education chief down here in whatever state and whatever? I ask that question, they say, I don't get much of an answer. And I don't understand their political economy either. Sensitivity to incentives of all actors. Incentives matter, right? Sharing and investments into long-run partnership. So I'm done. Thank you, Hewlett, and thank you.